Good morning.
Good morning.
Morning.
We're muted. If you want to get started.
Good morning and welcome. I will call to order the Board of Health meeting May 28th, 2025. I need to find out the quorum. Thank you. Let me remind everyone that the microphones are very sensitive. Every sound you make, the camera will record you. Don't be freaked out by that. Also, there are restrooms to my right through the door. And you go to the door, you'll find them. Okay, any questions? All right, so let's move ahead. We have introduction of, I think, two staff this morning.
Yes, we have two new staff members. So we'll start with Shawn.
Morning, everyone. I'd like to introduce Christian Vargas. He's our newest environmental health specialist, and he joined us on May 8th. You want to tell us a little bit about yourself?
Hello, everybody. My name is Christian Vargas. I'm an alumni from the University of Washington. I started environmental studies, and I'm really excited to be part of the Yakima District team and make a difference in my community. Thank you.
Go Huskies. All right, and our other new member, Gloria.
Hi, I'm Gloria. I come from Half-Oak Community Credit Union. I am an office technician, just help desk front. It's been a really great 3 weeks. Nice to meet everyone.
Well, welcome to both of you.
We also have two guests in the back.
All right. So, we have two people visiting us this morning. Would you care to introduce yourselves?
Jeremy Hines. I live in Tila, and I'd like to give a public comment.
Back to Jim Stevens at Sunnyside. Staff there. So, do a couple of comments about the fluoridation. Stand up.
You better be better so people can see you.
I've been practicing for some time in ministry at Sunnyside within all aspects of ministry. I transferred, we do more, less general ministry and sleep apnea, and a lot of referrals from physicians that come to our office. Patients have comorbidities. A wide variety, so we have a very interesting practice. It's very unique. We have a medical history that we take when the patients first come in. It's lengthy, it's more than they usually do at their physician's office. And so we review that at their first appointment, and that first appointment, just for that part, is often 2 hours. So we do a deep dive into what's going on. CT scan, which is a CAT scan with low radiation, very here. Discussion about that. Treatment plan, and then coordinate that with the physician, and then I may refer that patient to other healthcare providers. They take their particular situation. We have over 100 different healthcare providers that I utilize, and I either talk to them personally, I have them personally, or use them myself, but I want just to talk to people that are really on top of things. Not to be disparaging, every every healthcare provider has their own issue and their own niche, and they're doing their thing and they're trying to do the right thing. Instead of allopathic medicine or traditional medicine, working outside of that, sometimes they're just not addressing the issue, and they don't see it. And some reason some of these doctors are sanctioned if they're for certain things, they'll be sanctioned, if they go outside of the allopathic world. Not practice, it's just this is what we want you to think. Say, and you've all probably experienced that in some way. I experience it on a daily basis. One of the issues that we're talking about here is fluoride. And so, fluoride into the water supply in Yakima years ago. It seemed to me that fluoride for decay, good old hygiene, don't need it. Why should they have fluoride? What's that doing for them? And so if you look at the compound fluoride, fluoride is called a halogen. This means a salt maker. And so 5 halogens, 4 of those that you readily recognize as fluorine, of course, chromium, and iodine. Well, iodine is something that if you go into your physician, there's something that's low on your scales. Iodine is one of the ones that is commonly low on the scale. And so, interesting enough, fluoride and iodine, both halogens, we have what we call receptor sites in the body. And so receptor sites, your chemical comes in and likes that receptor site, does its thing, makes its compound, works magic. But there can be competition for these receptor sites. So fluoride competes with iodine for receptor sites. And one specific that we can talk about is thyroid. So this can lead to thyroidism. This is one issue. I think there's a lot more. There it has come down the line. I have never seen such changes in the healthcare field that I have in the last few years. We're experiencing the dentistry. It's monumental. It's exciting. It's very exciting. I'm talking to a physician right now. We're talking about cell intelligence, cell communication, how it works. Now, this gets pretty exciting. It sounds pretty wild. Cell intelligence. It sounds pretty strange. So you start to think about there's individual cells in the brain, how do you think? Cell communication. And we're just scratching the surface of this. And now we're talking about fluoride and competing on the receptor sites. Now we think that this could go on even further. I think we start to do a deep dive and we start to see artificial intelligence take its place in the seat, the decision making, and it's happening rapidly. This is going to be a freight train. It's already coming, and it's going to be fast, and it's going to really impact the field of medicine positively, very positively. So we're going to see a lot of this, and I think when we see that, I think the concept of fluoridating our water supply is going to look like something that's pretty arcane. I
Actually, that's going to be just a minute longer.
say it again.
We need just a minute longer.
1 minute. Okay. What up? No. I really enjoyed hearing myself talk. And I was going to have it recorded. So that's somewhat the crux of it. We look at other issues that are similar to this issue of the growing dentistry is silver fillings, these little dark fillings in your mouth. Well, they're called silver fillings, but they're 50% silver and they're 50% mercury. And the American Dental Association, if you look it up, they will tell you that mercury fillings or amalgam fillings are safe. I had the industrial high dentist come into our office. He said that it doesn't do anything. He came into our office and we're a holistic practice. Oh, sensible here. It's a little while that dental school all these mercury fillings with different plastic teeth. Check it. He said, well, there won't be anything, but they're so long. They'll be dissipated according to the American Dental Association. So we tested 10 microns per meter square of mercury that was emitting from it. He said, no, wait a minute. So he brushed it. It went up to 300. This is sitting on the counter. It's not a waste acid environment. So these are not safe. It's being advertised that they are safe. I know they're not safe because I made a life of practice of taking these out. And I saw people that had one of them MS, and she was going to be in a wheelchair. She was skiing on a bachelor a year later. When the gal came in with arthritis, she's 30 years old. 2 years later, I saw her at the meeting, no arthritis. She said, I said, what did you do? She said, that is all I did. So these are, the reason I bring this up is these are somewhat parallel as to what's going on in the field. And you're a decision making body that has a real impact here on a lot of people. And I think that listening.
I'm Jeremy Hines. I brought a little cheat sheet with me so I could make sure to get numbers correct. Basically, so I live in Selah, Washington. The chemicals that are added for water fluoridation are considered hazardous waste by the EPA. And while there is some fluoride that's naturally occurring, the fluoride that's added to water is not naturally occurring. The chemicals that they use for water fluoridation are byproducts of industry, and they're fluorosilicic, hydrofluorosilicic, and hexafluorosilicic acid. And they're classified by the EPA as hazardous waste. The chemicals are identified on their material safety data sheets, or MSDS, as toxic substances. And public testimony for the EPA established that there are that fluoride that's used is unsafe at 1.5 ppm. And usually the threshold is 10 times or 100 times lower than the unsafe level. However, the current guidelines are 0.7 ppm, which is only half, not 10 times lower or 100 times lower.
Mr. Ibach, do we have anything to read from us? No. Okay, thank you. We will move to the consent agenda. All items listed with an asterisk are considered routine by health board. It will be exacted with one motion. There will be no separate discussion of these items unless a board member requests, in which event an item will be removed from the consent agenda and considered in its normal statements on the agenda. Could you read the agenda, please?
April 30th, 2025, the Acton Health District Board of Health meeting minutes. Payment of accounts payable payroll issued in April 2025, the amount of $1,153,652.64.
Thank you. Any comments or questions?
Approve the consent agenda as read. I'll second.
We have a motion and a second to approve the consent agenda as read. All in favor, please say aye.
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 Opposed? Thank you. I'll wait longer next time. Thank you. All right, motion passes. Okay, now we'll move to the Acton Health District Spotlight, which is supporting safe food vending, and Shawn, our environmental director, is going to be talking to us.
All right, good morning, everyone. So yes, today we're going to be talking about safe food vending in Yakima County and work that we do in that arena. So a little background to this. There is a difference between temporary events and street vending. We'll get into the definitions of those a little bit later. However, both of these types of retail food sales are becoming more visible, more popular, more widely attended in our county. And the rise in this type of food vending also demands more need for safe and permitted operations to make sure that we're preventing foodborne illness out in the community. So looking at the difference between temporary food events and street vending, temporary food vending at events is by code, they're allowed it only at permitted public events. So festivals, fairs, an example I like to use is like Downtown Summer Nights here in Yakima. That's an event, and temporary food event permits are meant for those type of events. So they are required to get a temporary food establishment permit through the health district, and these vendors are required to follow all the food safety guidelines outlined in the Retail Food Safety Code. Street vending is allowed by code when selling, and it's defined as selling food in public spaces such as sidewalks, parking lots, or street corners. They have to have landowner permission or permission from the city or county to operate there, and is only allowed if they're selling exempt foods. So whole fruits and veggies, commercially prepackaged foods that are considered exempt. The different requirements around or different things that require a permit to sell foods are typically ones that involve preparation, temperature controlled, or is not considered exempt. If they have to prepare it, cook it, keep it cold, keep it hot, typically that's not going to be an exempt food. So we're looking at raw meats, dairy products, cooked veggies, cooked meats, cut leafy greens, cut melons, and there's a few other cut fruits that would fall into that category as well. Improper handling of these foods lead to a lot of foodborne illness, and the common pathogens we find are Salmonella, E. coli, norovirus, and Listeria. If you ever had any of those, they're not fun. Some other general requirements we're looking at does the food come from a commercially approved source? Is there adequate temperature control? They have adequate hand washing. The ability to cook to safe temperatures. They have to have a thermometer with them. The ability for ware washing, so cleaning utensils and equipment as they operate. They have their food worker cards. They're able to prevent bare hand contact with ready-to-eat foods, and safe waste disposal, whether it's food products or wastewater. So what we do is we go out and we inspect every temporary food event establishment that has a permit with us. So we go out to ensure that the food is prepared and cooked safely. It's safe to serve to the public. We're looking for different issues that could arise at any one vendor, and we work with them to correct those issues and come up with a sustainable solution for them to do it right and do it safely. And our goal is to protect public health. And in addition, we come out with a kind of a coaching and educator mindset, and we want to build trust in the local food industry, that we don't want people to be afraid that we're coming. We want people to feel like, oh, the health district's here. I'm doing everything right because I worked with them on how to do this, and they're confident that they're going to have a good inspection. So there is a risk. Lately, we've been dealing with a large increase of unlicensed street vendors. The risks involved with this are they're typically selling temperature control for safety foods. They're prepared, they're stored, they're in unregulated settings. So even as a temporary food establishment or a vendor, you have to prepare food in a commercially licensed kitchen. And a lot of times these foods are being stored and prepped in a home kitchen. So very unregulated situation. There's no inspections for food safety or sanitation because we don't know they're out there. They don't have a permit with us. We can't really find them. It's just coincidence when we do. With no regulation and lack of safety control measures, the risk of illness rises, especially in vulnerable populations. violations. And how we address unlicensed vendors in public spaces, there's some variation, but in general, we see the vendor, we'll inspect them. We'll ask for a permit, we'll start looking at how they're operating, if they have everything they need. But the ultimate deciding factor on whether they can be operating there or not as a street vendor is the vendor exempt from permit. If yes, we'll make sure they have everything they need, such as hand washing and wastewater disposal, those kinds of things. Because even though they're exempt from permit, they're not exempt from the regulation. They still have to meet those requirements. If they're not exempt, we will review what permit requirement, or we'll review the permit requirements with the vendor, educate them on how to get permitted, how they can operate appropriately under that permit. We will request they close down, but we'll provide them application documents and educational materials so they can go through the process as easy as possible the next time they want to operate. If they do refuse or they do shut down that day and they come back the next day, law enforcement may be involved to support us in addressing those repeat violations. We'll get into what that looks like here in a second. Or right now. So, as I said, there's been a very large increase of unlicensed street vending in city of Yakima, particularly. We suspect it's happening. It's starting to spread throughout the county. We're working really hard to try to address this issue. But there's been a large increase that we noticed happening starting about late February. We sent environmental health staff out to work with these vendors through our usual process. We go, we identify where they're operating, we make contact with the vendors, we have a conversation with them about permitting requirements and what they need to do to operate appropriately in Yakima County. And a lot of times that works, but for a handful of these vendors that didn't work. They would shut down that day and then come back the next. And after a couple times making contacts with these vendors, they started to get fairly aggressive and hostile towards our staff. Lots of screaming, yelling, picking up sharp objects when there was no reason to. It became apparent that we shouldn't be there without the support of law enforcement based on their response to us. So our response reached the enforcement level at that point. They're repeat violators. They had no interest in getting permitted. They never came to the office to have a conversation with us and fill out, or even attempted to fill out an application. So over several weeks of responding with law enforcement there to just supervise the situation, and we would shut them down. They'd come back the next day. We worked with the City of Yakima Code Compliance Division and with Yakima Police Department's Detective Division and set up an emphasis event this last Saturday. So we went out in the evening. We were out there till about 9:30, 10 o'clock. We found the main repeat violators that we've been contacting multiple nights a week. They were closed down and they were issued citations through the City of Yakima's municipal code, because their municipal code requires a city business license and a health district permit to retail sell food. So we're hoping that has a positive impact on unlicensed street vending here in the city, and that this event and what YPD thought is we can start to build a framework that the patrol division can utilize this intelligence to respond to, and that we can build an effective process to bring to other cities across the county if they start seeing an increase in unlicensed street vending as well. In addition to this is a statewide issue. West Coast issue. These vendors have ties to other vendors and operators in California, Nevada, Oregon, Denver, Colorado. It's pretty widespread and a pretty organized, big operation. So we're discussing how we move forward with this with other local health jurisdictions and even other states But once again, the Yakima Health District and City of Yakima agencies kind of pioneering an effort that we hope is effective and with taking the least harshest approach first, but getting to a point where citations can be issued if necessary. So this is still ongoing. Time will tell if the message was received by these unlicensed street vendors. But overall, on this night in particular, we set out to catch 2 specific vendors. We ended up catching 5. So the 3 others that we made contact for the first time, no citations were issued. They were just educated on the requirements to get a permit and how they can operate. But they were informed if we do find you out here again without a permit, YPD may issue a citation at that point.
Shawn, yeah, if you don't mind, those 5 folks, is it cost? Is that why they're not looking to get a permit, or is it just?
Maybe. Well, 2 of them are in the process of getting brick and mortar food establishment permits with us already. So they just jumped the gun a little bit. The other one, I don't think they had any idea that there were temporary food establishment permits or a seasonal license. But the way these folks are operating, it'd be more appropriate for them to have a mobile unit and have a mobile license or operate at a farmer's market or flea market under a seasonal. Our fees are probably the lowest in the state. So, a couple $100 and they can operate for 6 months at a farmer's market. So
Yeah, these are $50 a license, so it's really real low barrier.
Where they're setting up, do they have permission from property owners?
sometimes yes, sometimes no. So one location was at the Target. They did not have permission. There's a standing ordinance that plaza has that there's no street vending allowed. Yeah, once the owner of that plaza found out that they haven't operated their sites.
When you go and you find these sites and you're looking, what are the significant hazards? Are there any significant hazards?
Oh, absolutely. When we've made contact, there's no hand washing. There's been no disposal mechanism except for a small trash can or two, so they can't get rid of any. Well, there is no wastewater because they don't have water. Nowhere to really throw food away. They don't have any sanitizing equipment for all their utensils. There's no food worker cards. There's no bathrooms for the workers to use. And they're out there typically from 6 p.m. to 2 a.m. So,
Commissioner,
no
I'm sorry, Commissioner, can your hands up?
Thank you, Madam Chairwoman. Shawn, can you tell me, you briefly touched on and described where these folks are migrating from, or at least have strong connections and ties to. So can you share a little more? Is this a language barrier? Is this a cultural issue? Is this somehow tied to migration of people into Washington, California, Colorado from other areas where they're not accustomed to this? If you could just expand a little bit.
yeah, from what we found out talking with these folks, they are everyone's been Spanish only speaking so far, and we have Spanish speaking staff, and as does YPD and city codes. So we're able to communicate. All they will tell us is that the owner drops them off, they operate, and the owner picks them up. And working with other counties in the state, with Franklin, with King County, Tacoma Pierce, we found that there's all the vans that are being used are tied to 2 individuals in the Bay Area of California. So we think that there is kind of a central hub where people are funding this operation. People go out, operate, get to keep a chunk of the money, and the rest of the money goes back to these folks in California. But we haven't been able to get any identification on those folks in California, or really even get them on the phone or anything. So it's all a theory at this point that's still being investigated.
I thank you for your brevity, Shawn, because I think the reality is that a lot of folks don't understand that human trafficking as a matter of fact of mass illegal immigration in our country absolutely shows itself. And this is one of the ways. And I applaud you for working with law enforcement. And this really is a danger to you and enforcement and to our community. And I applaud your efforts, and I hope that our law enforcement can continue to pursue this, because this is the way it shows its face.
Yeah, and that is, we're aware of that possibility as well. And there's questions being asked about, are you here at your own will and things like that, being made by not us, but law enforcement. So, you know, they are considering that as a possibility, and it's just going to take more investigation and more time contacting these folks and talking to them.
May I add something, Shawn, if you don't mind, to Commissioner McKinney's point, and also to address what Commissioner Curtis said earlier. We often see people who are hardworking individuals who might want to make some extra money by doing some street vending, and usually those people are quite compliant when we talk about how the process works. We're very encouraging, and that's what we often share as our business cards, and also how we can receive them in our offices. That said, what we're seeing with these unlicensed food vending, these specific ones, this is an orchestrated process. These people are intentionally trying to skirt the law, and they are very disingenuous, giving false information, very much attempting to operate at hours when traditional departments are closed, targeting communities that have high factory workers where people have shift work and get off late. They're attempting to skirt it. And more importantly, the issue of what the investment would cost for them to have a legal operation, a licensed process that keeps people safe would be, you know, in the tens of thousands for some of these. And they don't have that. What they have is exceedingly rudimentary. They are not following any type of health concerns you would follow in your own home. So that's our major concern. There's a dramatic concern about people's health, and we're hearing that people are getting sick in our community from this. The other is that these people are exceedingly aggressive. So that's why we don't want our staff to go out and address this without law enforcement's partnership. So that's why we want to invest in this long-term relationship, because we don't think that it's going to be going away anytime soon. I think this is just a normal occurrence that you're going to see.
Yes.
So talk about the city of Yakima. Have you got complaints or notices about this going on in other areas of the county? Because I'm sure it's happened.
Yeah, we've heard in Lower Valley that it is happening. Specifically Toppenish and Wapato. So we're making plans to do some after hours surveillance down there. We haven't had any complaints from Sunnyside. I've worked with City of Sunnyside's code compliance officers before, and they're very proud of what they do. So I think that they see that sort of thing, they're stopping it pretty readily. But
I'm seeing outside of city limits.
Outside, yeah, that makes sense. So yeah, we do have to do some surveillance work down there. We wanted to come to the Lower Valley after, you know, starting to work the problem here in the city of Yakima, and see if this partnership with YPD and city codes would work and how effective it is, and then bring that model to other cities, and that way we could have an educated conversation with them about what works and what hasn't.
The other thing, Shawn, that we may want to start doing, to Commissioner McKinney's point about the human trafficking, we brought in Russ Tuttle, Safe Yakima did, to talk about youth sex trafficking. And the presentation went to 4,600 youth and parents. And out of that, students came forward that were basically acknowledging that they know of kids being sex trafficked. There were 8 identified at Franklin Middle School, girls that are all related to one family. And so maybe we start tracking these and we look at launching a massive education campaign. I still think there's a disbelief in the community that it doesn't happen here, that it doesn't happen to youth, and youth are absolutely being targeted through these. Etsy, Pinterest, there is no safe app. The perpetrators target them And once they befriend them, they actually build their trust. Where do you live? They're leaving phones in bushes. So then the parents can't track them on their phones. And so as you guys are running into these workers that are saying we're dropped off, we probably should be keeping account of that and maybe looking at a public campaign.
Yeah, well, the workers we make contact with, law enforcement is identifying them. One of the contacts we made, they started off by giving false information, and they found that out pretty quickly, and you know, they got their correct names and actually got good identification on them. So
Well, Shawn, the good identification is very limited, and sorry, but based off what Alicia had just spoke about, the real issue is that our law enforcement's hands are absolutely tied in the state, and is because we have laws that prohibit them from acquiring about immigration status. We are not able to find out where they're from, whether or not they're here legally. And if you don't think that's important to conducting an investigation to truly weed out human trafficking and this type of gang violence and crime, you are fooling yourself. And this is another example, again, of how this state has got to find its way back to logical reality. If we're going to fight crime, we need to be able to know who these people are, where they come from, and get them out.
So you said 2 citations were issued.
citations were issued to each individual operating the vending stand. So 6 total.
And do we know how much?
I believe for the municipal code, it's $500 for the first offense.
And how many offenses do they get?
The next one will be $1,000 in jail. Yep, and they were made aware of that. So I saw their TikTok last night that said they're temporarily closed at the location we found them at, but they would be setting up at a new location soon. So we have more work to do soon. I don't know if it'll be in City of Yakima, but.
Well, at least we could track them on TikTok.
Oh, yeah. I'll give you the names offline. Okay.
Any other questions or comments?
Oh, we got a couple more slides.
Oh, I'm sorry.
Yeah, so moving into, how we're taking an approach to all of our retail food in Yakima County. We a couple of years ago, we've been trying to apply a broader practice here. So we're bringing bilingual checklists to operators so they can literally see, oh, do I have my thermometer? Do I have my bleach? Do I have my hand wash? Do I have everything I need to be successful out in the field? So when the health district shows up, and they ask, where's my thermometer? I say, oh, I forgot it, or oh, I don't have one. It's just a kind of a resource for them to be able to double check that they have all the equipment that they need. Of course, building partnerships with community organizations to put out more resources and more education into the community on how to do this the right way, and that they don't have to be afraid to do it. We're here to help them, and having community organizations also put that message out on our behalf has been very helpful. And promoting safe vending through supportive and accessible resources. Again, doing community events and workshops has been a huge benefit for folks trying to break out in this industry and do it the right way. And I believe we have a quick video here. Next slide. Yes.
Los eventos de comida temporal no solo son una oportunidad para que los negocios locales muestren sus habilidades y compartan su cultura, sino también un parte esencial para proteger la salud y seguridad del público.
By promoting food safety among local vendors, we help protect consumers, we prevent foodborne illness, and we support the growth of safe, thriving businesses in our community. Food permits play a big role in that.
Pues sí, necesitas un permiso para vender comida en eventos públicos y parte de esto es seguir buenas prácticas de seguridad alimentaria. Y para mí esto es comenzando por mantener mi área muy limpia y tener un desinfectante seguro para alimentos a la mano.
Before I start anything, I always make sure my hand washing station is fully set up. And when I'm handling food, I use gloves and utensils, just simple steps that go a long way to keep food safe.
Una práctica muy importante es revisar la temperatura de los alimentos con un termómetro. Reviso mis comidas calientes y frías con frecuencia. especialmente en el verano, cuando es más fácil que suban a niveles peligrosos. Esto ayuda a prevenir que alguien se enferme.
Queremos que el proceso sea accesible y claro. Cuando los vendedores de comida se sienten apoyados, tienen más posibilidades de tener éxito. Y cuando la comunidad sabe que la comida es segura, es más probable que apoyen a los negocios locales, ayudando a que crezcan.
Events like these are really valuable because they give the community a chance to meet the Yakima Health District staff in person, making the whole process more approachable. You don't need to be nervous about the inspection. Yakima Health District is always willing to help you ensure your setup meets the requirements. It's pro-business. They're making sure we can serve food safely and prevent illnesses without risking our reputation.
The Yakima Health District is not just a regulator, it's a partner.
All right, so that was from a couple of weeks ago at a temporary food event workshop that we had at Cafe 1997. And we did one about a year ago this time, and we had over 25 vendors show up to learn about our process and to kind of see how an operation works successfully. So very excited about the turnout we had and look forward to more events in the future. So tying into our strategic goals, as you know, food safety is a mandated service of the health district, and educating the community on how to get properly permitted and to operate appropriately, just strengthens our mandated services and helps us in doing our job when the community or the food industry professionals also help us do our job. Certainly developing a network of community partners invested in improving public health, whether it's been through community events and workshops with community organizations or with local law enforcement or other municipal code divisions to help us address the issues of unlicensed vending. Everybody has the same goal, and it's that there's a right way to do this, and we want everyone to be able to pursue their desire to serve food as a business, but they need to do it the right way. And with all this outreach and these broader practices and partnerships that we're building, it certainly increases the effectiveness of how we're able to regulate food safety in Yakima County and the efficiency of that through building the education and confidence of our food industry professionals. That, are there any additional questions?
Just a quick comment. It's a good video and a good approach. I just want to commend you for your approach. Just a side note, I noticed one of the vendors they were interviewing, the business at the bottom said "Foco Loco," which means a little crazy. So
I noticed that.
That's kind of fun.
I thought of the movie Coco. They sing a song called that. My kid's favorite.
Yeah, I would also comment and commend just the amount of education, that's great, and the outreach. I also received feedback from a vendor that thought this was a great way to learn, hands-on, very easy. So I hope that this is going to be an annual event.
Well, I mean, the credit goes to the team and all the staff that work directly on it. I kind of just signed my name on the requisition form, but they did great work and came up with some great ideas on how to do just that, make it seem as simple as possible and try to break down the barriers that people feel they have into breaking into the industry.
Need assurance it's not your regulator, your partner.
There we go.
Well, until he has to go back to the vendor a second time and
Yeah,
it turns
right.
to the regulator.
You turn the second time. Get a shirt that says not today.
Today I'm not your partner, I'm now the regulator.
Yeah, we have to balance that.
Very well done. I once brought to that the organizer for the Sealer Community Days, which was a week and a half ago, was at the event. So
That's great. Any other questions or comments for Mr. Magee? If not, we'll move on. Thank you very much. We are at agency reports. We'll start with Executive Director Andre Fresco.
Thank you, Madam Chair. Good morning to the board. Thank you for your patience as we navigate our construction at our building, and thank you for being here with us. And thank you to our team. set up early. Victoria and Mariella always willing to do it. It's not easy to do it. In fact, I miss our large executive conference room. But it's great to see everyone in person. I wanted to first just add my appreciation to what Shawn said in terms of our team. We have been fortunate to hire staff who really want to serve our community. And we are creating opportunities for them to really shape the future work that we do. And it's really exciting because when we say that we're pro-business or supportive of the community, it's often hard, I think, for people to see that. And so these events have not only been educational for those that we're putting these on for, but it's really been able to express to them that we're here to educate and we're here to support and we're here to serve. And there are things that we invest in our agency that others don't, like having full-time staff available for walk-ins at our help desk, which is really expensive, but I think also shows that the difference between a pre-recorded message or waiting in line or waiting weeks to get served to being able to get served quickly. And so that's the same as picking up the phone and speaking to a person. It's the same thing that we invest in. So this is actually bringing what we do internally every day out to the community, and that's really exciting for us. And it also shows that people have the opportunity to embrace the American dream. These are hardworking folks who want to serve and often limited means, and this is their opportunity to grow into perhaps multiple locations or brick and mortar establishment. We've seen that happen many times in this valley, but it's hard to do. And so being part of that process where they're encouraged and excited really means a lot to us, and we'll continue to do this throughout the year. And we want to expand it to other areas of the valley as well. Absolutely. So that's exciting. I also wanted to give my appreciation to people behind the scenes who may not often realize how impactful they've been, but Mayor Byers has been supportive of this process of working on this unlicensed food vending. Sarah Watkins, the attorney for the city of Yakima, certainly Vicki Baker, the city manager, have been really encouraging. And I wanted to share with all of you that these partnerships are not just about bridging differences or working together, it's the complexities of the jobs that everyone does. So code enforcement and law enforcement and public health regulation, they're not always complementary, and we don't want to add to the already difficult jobs that people have. So the goal is for us to align and make certain that we are able to work effectively. And this operation that we have here tonight is an example of that, being able to ask people to work in the evenings, after hours, to do these things. It's not what people often are able to do. So I'm really very grateful, but also proud of this community for being able to do something wonderful. I'm also encouraged by the conversation that we had about human trafficking. It's not just trafficking, it's not just sex trafficking, it's the fact that poor people are often taken advantage of. And so when you have people who show up trying to work and they're part of an operation that's not legal or not up to code, they're not aware of that sometimes, and they're put in a really difficult situation. So we're trying really hard to work on not having that happen. And again, I'm really grateful that we haven't had these issues all these years in our valley. Very, very fortunate in terms of food safety and food compliance. But the issue of trafficking, sex trafficking, manipulation is certainly apparent in many cities. And so, as Shawn said, we're trying to coalesce this and be able to create a best practice for other communities. It's unnerving for me to find out, and I've had these conversations, as has Shawn, how many other communities are going through the very same thing we're going through, and it's not being discussed. And so that's why we're going to bring it to the forefront. And we're even talking about having statewide meetings here at the health district after our renovation to encourage those kinds of conversations. And we want to continue to support our partners. So thank you.
And Andre, one of the other things that we found is even with the workers, when they're giving dishonest information, that is a form of grooming. They have been coached and coached and coached and threatened and threatened and threatened. So it is an absolute form of abuse. And the only way to break through that is the constant education, the constant messaging that there's help out there. There's other ways to go about it. That's the only way we're going to break through. And so that's why I say that it's important that we start tracking that so that we can start. Obviously, I kind of got a grin when we were looking at the outreach campaign at the vendors. It's prevention, right? We're preventing. we're preventing these things, and it's all about education. That is what prevention is. And so we have to do the same, I think, with the human trafficking aspect, but 100%. Last year I had Chief Cobb reach out. I had vice principal down in Granby reach out, and I had Sarah Cordova reach out and say, can we find a way to fund bringing in Russ Tuttle? And I said, is this an issue in Yakima County? And they said 100%. That was the first time it hit our radar. So we scrimped and scraped and did what we could to bring in Russ. And it was astonishing the number of kids that said they're having fellow students reach out and say, send me new photos, and they're trafficking those photos and threatening them. You know, they're blackmailing them to steal from their parents, and it's astonishing.
Grave issues that we're having to address, but it does bring to the forefront that we have an expanded portfolio in public health. There's more to do. But I wanted to also share, it's not for us to do alone, it's us to do through partnership. And that's one of the things that's hard to do. It's hard to do financially, it's hard to do in terms of planning. And so that's part of our long-term agenda. And our team is working on that. And so these interrelated issues that you're addressing, they're not just one-offs. And so that's where it's a long-term goal. But we'd like to address that. I want to give you some updates at the state and federal level. We have yet, as I understand it, have yet to have the Secretary of Health appointed to the role. That is really, I think, unprecedented to have this long. The acting Secretary of Health, Jessica Todorovich, has been very capable, but also having to, again, address complicated issues like reductions in force and reductions in state budgets. That will continue. They're going through a bumping rights process with state employees, which is complicated, and we anticipate that continuing. We're also starting to hear about changes at the federal level to federal funding. And that federal funding comes not just to public health departments like ours, but to cities, city agencies, county agencies. We anticipate reductions. And what has been described to us is that those reductions will then be replaced by money given directly to states, but that historically doesn't always happen, and that doesn't always happen effectively, and there's often strings attached to that. So it's a really complex issue that's also affecting concerns around Medicaid and those who receive Medicaid, and that would affect, as an example, our federally qualified health centers, FQHCs in the Valley, like Yakima farm workers. I see Commissioner McKinney has her hand up.
Go ahead, Commissioner.
Thank you, Andre. I have to put a little pin in what you just said, because it's important to note, though, that with the federal cuts to funding, we would still not be at pre-COVID levels, adding for population increases in inflation. So the massive amount of spending is something that has to be reined in, and that's exactly what is happening, and it is fiduciarily responsible for the government to do so. Second, Medicaid is not being cut, but what is important is that we are requiring able-bodied adults who do not have children to have to work, and they are rooting out waste, fraud, and abuse, which does absolutely occur in Medicaid to the tune of billions of dollars a year, known and admitted by the internal investigations through various administrations. So I think it's very important to say that you have to be careful. We're not cutting funds. There was a massive amount of spending that occurred from COVID, and we have got to go back to what we were doing before, which, by the way, was already too much for the taxpayers to fund.
So Commissioner McKinney is correct that there's been no discussions about actual Medicaid cost reductions to those receiving it. But there has been discussions about reductions to funding payments for organizations that provide Medicaid services. So again, that is a reduction perhaps in staffing levels and so forth. And we're going to see some of those cuts in some of our programs. And a lot of those programs are addressing the issues of low-income people or people with access to care. So I think that is going to be something that's concerning. We're now wrestling at the state level with reductions in funding to local health jurisdictions. We have been able to handle in the last few months reductions from federal funding, and we anticipate being able to manage reductions in the costs of running a health department. And so we've been fortunate, and I think that we've been fiscally prudent to Commissioner McKinney's point, again, fiscal integrity is important to us, operating well, and that's one of the reasons why we do cross-training as we do. We've done it well, but we don't know where those cuts are going to be. So it'll be interesting going throughout the summer, and I will certainly update you on those things. And that's my report, unless you all have questions.
Any questions for Mr. Andre? Thank you. And then we'll move on. Next is Chief Operating Officer Ryan Ibach.
Okay, I would like to also thank the Department of Ecology for allowing us to use the conference room. Our remodel of the Yakima Health District is on schedule after 2 weeks, and so we will continue to use that. It's supposed to be, the first phase is supposed to be done at the end of July. So we will continue to use this conference room for the June and July meeting. We should be good as we come on back in our building. Wildfire season has begun. We had the first fires at the Yakima Training Center just recently. And so we will continue to monitor air quality as we have wildfire smokes, and also power shutdowns, and making sure that we're communicating with businesses on those issues. Also, on that note, the heat, the WIAA State High School track heat is at Eisenhower this weekend. And so they want us to let everyone know, just make sure there's no conflicting messages, that they are monitoring heat index, because it's supposed to be in the 90s throughout the week. And so there is concern about the temperatures, and especially the 3,200 meter race, which is 2-mile race. And so they are monitoring that. They're making sure that there's unlimited amount of water for the athletes. They're watching and monitoring athletes for any necessary medical action. So they just wanted to make sure that we were letting people know that they're on top of that. And then also, last month, Andre was so kind to bring up that I had 26 years of service. Now it's my turn. Andre has 13, half as much. This month, congratulations for
Very good, then we'll move on to our financial report. James Porter.
Good morning. My report starts on page 9 in the Board of Health packet. It'll also be up on the screen if you would like to follow along there as well. Through the month of April, we had a loss of 122,000, bringing us to an annual loss of 644,000. Our allocated budget through the month of April for revenue was 4.5 million, or actuals are coming in at closer to 3.4. While expenditures, our actuals are at our budgeted was at 5.2 million, and our actuals are coming in around 4 million. Any questions on the summary sheet? All right, moving into the income statement. The first piece is the Foundational Public Health, the FPHS, which is super tiny up there. You can't really see it. So on your packet here, you can see that I would say that we're short $1.2 million. That is a little bit incorrect, as we received that money last year. We received that money in 2024. It'll be reflected a little bit later in this income statement. We are expecting some more funding to come in July 1st, or mid-July actually, is probably when it actually hits our bank account. So that's on its way. Moving down into the expenditures, the largest being in enhanced capital. As Ryan said, we just started in on the building, a couple weeks in now. I'm expecting to have, or we'll be expecting to have some intermittent invoicing going through the building. And so that'll start to tick down that large difference that we have. Questions at this point? All right, moving into the second page of the income statement. So I'll just point out here down at the bottom is where we're reflecting the 2024 FPHS funding. We're carrying over $2 million of that funding, of which we've expended approximately $1.4 million of that funding. So the 650,000 you see on the right there, that is what we have to spend through the end of June for FPHS funding. Just wanted to highlight that. Is there any questions regarding that? It is a little strange, a little wonky. All right, moving into program specific. I'm not going to necessarily address anything specific unless you want to know about it. We are the clay section that we have here is the FPHS. Again, that's the timing issues, and that will continue to carry throughout the year. Moving into the next section. our environment, our community health programs, and everything's moving along okay. And then we're moving into the blue section, which is EH. Spring has sprung in EH. I can see them actually starting to generate a little bit of revenue against their losses. Next page, please. EH is starting to even out a little bit. Last month there was more asterisks and T marks on there. That's a little hard to see up there. Definitely hard to see up there. Moving into the last page, unless there's any questions. Pretty quickly, is our cash flow. We have $15.7 million in cash and reserves. That I expect that balance to tick down as we head into the month of July, and I expect it to tick up a bit. Especially since when we start paying for buildings, that'll really start to tick down. So, any questions? Seeing none, that concludes my report. Thank you.
I wonder if there's no questions, we'll move on to our health district officer, Dr. Neil Barg.
Morning. Somebody told me a couple weeks ago. Break that today.
Yeah, thank you.
Just to keep up with measles, a new imported case came through my front at the airport, CTAC, and that person had done extensive international travel. Just to reiterate, if that person comes into contact with people, likelihood of them catching measles is very high. For each case of measles identified, and if they're exposed to a susceptible population, 10 to 13 new cases. So that's my voting through unvaccinated. There's also been mention government level of developing medications to treat measles, and when it's preventable by vaccine, it's going to be far cheaper, far more effective. It doesn't have as much side effects as a medication. So I think we should still accept measles vaccination and encourage it for people, the parents have their kids vaccinated. It's far more effective than any medication create. I couldn't really let the opportunity to talk about fluoride pass, which I know Dr. Just so many dentists support it, and I think if we want to really talk fairly about it, we should have some of our community dentists tell us what they think, and I think we'll find uniformly that they support fluoridation. This has been going on for 50 years or so, even more. It was first done in Grand Rapids, Michigan, and its effectiveness has been shown in multiple well-performed studies. And as was pointed out by the two visitors, the level that's monitored, if the at or below 0.7 milligrams, it's a very small amount. It's equivalent, I wrote it down, 0.7 milligrams per liter. Okay, that's equivalent to putting 3 drops of fluoride in a 55-gallon barrel. That's not a whole lot of fluoride.
I was gonna ask.
We have big mics.
Oh, you have the big mic. I was gonna ask a consideration, Dr. Barg, and that is that under new business, Amanda McKinney has fluoridation as one of the discussion points, so we can have that conversation if you'd like.
That would be fine. I'll just pick up where I left off.
Yeah, thank you so much.
And because I'm trying to be brief, I won't have anything else to talk about.
Any questions for Dr. Barg? Thank you. We will move forward to disease control. Melissa Sixberry.
Yeah, that was great. I'll be brief as well. Everything I'm going to talk about this morning is respiratory. So last month we had 17 cases of tuberculosis, of active tuberculosis that we were monitoring. We have since had patients complete their treatment. So we are down to 12 cases that we're currently managing. And remember, these are anywhere from 6 to 12 months of treatment. So some of these people have been diagnosed for, months ago, but the treatment is still continuing. For influenza this year, we have stopped our monitoring with our local hospitals on our influenza monitoring because we went back down to baseline. We did, however, have 16 influenza lab confirmed related deaths for the flu season, which is a pretty high number. The state also saw an increase in numbers. There were 463 flu deaths reported so far. for the 2024-2025 season. Previously, over the last 8 years, on the data I was able to find, there's been anywhere from 0 to the highest being 187 deaths. So 463 was a pretty big increase this year. I'm not sure the reasoning for that yet, but we did see our flu season was a lot longer than typical flu season. We didn't have the high peak that we would normally have had, but we did have a very long flu season.
Sorry, Edie's wondering, was that 16 deaths in Washington or national?
The 16 deaths were for Yakima County specifically, 463 deaths for Washington State for this flu season. And then Dr. Barg covered the measles. So that's the end of my report, unless there's any questions.
Just on the tuberculosis, 17 cases currently still.
That's how many we had at my last report last month. We are currently down to 12 because we had people complete their.
So I noticed in Chase's report that it shows that like we spent $90,000 so far this year to combat this issue.
Yes, and there's a lot of factors that go into that. Some individuals, if they don't have health insurance, it's our responsibility to, because we have to do follow-up testing, we have to monitor labs, we have to do chest x-rays, and so maybe medications. So we always bill to insurance first if we can. Health district's always the last resource for that. But it's not just the staff time, it's a whole lot of other things like that.
The staff is highly educated, they're doctors and nurses as well.
And would you care to talk about how the initial DOT has to be done in person? So it's
yeah, until when we first start somebody on their medications, we're going out and seeing them in their home every day. So that's a nurse going out because you're monitoring for that crucial time frame when they can have side effects and severe side effects. So we have a nurse going out there, and that can be, from one end of the valley to the other. So it takes a lot of time. It's the cost of the gas to at the government rate to do that. So it's pretty costly in that, and it's also the time when you're doing your contact investigation. It's very intensive in that first month or so, where it requires a lot of staff time. It's a lot of going out and identifying any contacts, going out and talking to them, getting X-rays ordered, a lot of screening and testing. It's just additional resources, financial resources.
Melissa? So sorry, I apologize. I can't see. So I just had a quick question, Melissa. Can you explain to me, based off of insurances provided through Apple Health, what examples would there be for an individual who would not have health insurance in Washington State?
Anybody who's considered, some individuals are not eligible for Apple Health. Some people are underinsured, so maybe they have co-pays that they have to meet, but they don't have financial resources to do that. Then we're having to do that. There can be people who are undocumented, but these individuals are still living in this community, and it's still the legal responsibility for the Yakima Health District to ensure that the control of tuberculosis in our county. And
Thank you.
We do have contracts, and we are currently working on more contracts with these healthcare agencies to do this at a minimal cost, as cost efficient as we can. Which one of we can send it's called a quantiferon, and it's a test to check for antibodies for TB, and that can be sent to a commercial laboratory and cost us several $100s. We're set up to send it to the Public Health Keep County laboratory, where it's $50 a test. So we are always looking for ways to decrease those costs.
And if I may also, we benchmarked electronic directly observed therapy, being able to do it over computers essentially. That was really complex, but I assure you it was far more expensive before. And also not a manageable use of time. We have a very large county geographically, and it was just an incredible expense. And it also didn't allow for our nursing and other staff to work on other issues. So it's really something that we benchmarked here at the state has adopted.
And I will just add that, there are also, we currently have an individual who is not on Apple Health because they don't qualify, but they do work. And so not everybody gets health insurance through their employer, whether it's because they're not full-time, or they're a part-time employee, or their employer just doesn't offer it. So those are also people who are considered, but they don't qualify for Apple Health for many reasons. So
Alicia, did you have a question?
No, I was just gonna dovetail because this kind of falls under Miss Melissa's umbrella. First thing I wanted to note is a thank you to the health district that came across on an OD task force meeting that we do monthly. And it was that you guys posted an RV that was unsafe because of substance distribution, and law enforcement really appreciated that. They said, you know, it's been a long time since they'd seen that and it makes their job easier. So I just wanted to forward that thank you. And then I also wanted to bring to everyone's attention, really, we had 20 overdoses in a 24-hour period last week, Thursday, Friday. Car fentanyl is in Yakima County. It was, I text Chief Janice in Wapato and it is confirmed. It is 50 to 100 times more potent than regular fentanyl. It's basically laced with elephant tranquilizer. And so we immediately, as a part of the OD task force, one of the things we're doing is Safe Yakima is posting spike alerts, and then we're tagging, we can only tag 13 agencies on social media. So we identify who is gonna most likely come into contact with high risk individuals. And then we also notify neighboring counties about these overdoses. And we got, just with that, you know, again, it's about knowledge. I was contacted by NBC and ABC, so CAP and KNU, just covering it. Last time we had a spike alert, the Sunnyside Sun picked it up. It somehow the Sunnyside Sun migrated all the way. I have a friend in Banff that said, hey, I saw the article in Banff. And so those tags are working in terms of increasing knowledge. And of course, the message we're trying to deliver is we're trying to keep these people alive, right? You can't treat a dead person. And so we're trying to, it's a life-saving tool so that we can get them either exposed to MOUD and ultimately treatment. So of course, within the spike alerts, it does say treatment works, let's get you there. But in the event people are questioning, why are we doing this? I was doing a City of Yakima training and a person said, why don't we just let these people die? Wouldn't it save us a lot of money? And so having that difficult conversation and reminding people that substance misuse is an adolescent disease. If you talk to people in treatment, over 90% of them started with alcohol, tobacco, or marijuana as a youth. And so that's where the prevention focus, they don't start out on fentanyl. The majority of deaths of fentanyl are 25 to 60 years old. So they escalate into that. So I wanted to make sure that, again, more work needs to be done because clearly 20. And then I got a text yesterday from the Wapato fire chief that they had a full day of overdoses as well. So wanted you to be aware of that. And then a couple other things. Safe Yakima signed a contract with Washington Traffic Safety Commission. Yakima County is #2 in the state for impaired driving fatalities. Hispanic men and Native American men, ages 21 to 25 are the kind of the major culprits. And so we're hoping to do a positive social norms campaign. We signed a contract with a social marketing company, and we will start getting data and trying to have as many Hispanic men and Native American men in particular. We will also get female perspective that what messaging resonates with them, what is the root cause, why is it that in Yakima County we have so many impaired driving accidents and fatality. We're #2 behind South King County. And so that work is starting to happen now. I may lean on you guys to say, hey, we need participants in the survey or focus groups. So I wanted you to know that we're working on that. And then in August, we're going to do another series of compliance checks for alcohol. So last time in September, we did 97 locations within 4 hours and had a 20% or 26% failure rate. I said I would like to resume these on a regular basis, so we'll be doing those again as well.
Do you do cannabis as well, or is it just alcohol?
Well, we were waiting on, so Yakima kind of had a loophole with it in terms of permitting, et cetera. And so they have closed that loophole, but yes, our plan is right now they are, LCB has a pretty concerted effort in terms of focusing on cannabis. They had fallen off a bit on the alcohol, which is why we resumed those. And then they have not been able to do the training to those that have failed or those that have said, hey, we would like the training. So they have trained Safe Yakima. We can now go to bars, mini marts, any establishment that serves alcohol or sells alcohol, and we can do the responsible beverage sales training. The only time we cannot do it is if they fail and they sell to a minor, then the LCB will come in, because obviously there's fines and fees associated with that. We didn't want to get involved with that. So just wanted to dovetail under that there are substance related issues. And then the last thing, thank you to the 3 commissioners for signing a letter advocating to our legislators to please sustain the current levels of prevention dollars. Safe Yakima is pretty safe for the next 2 years. However, we have a ton of community-based organizations in Yakima that are at risk of losing 100% of their funding because of the current administration's skinny budget. They are in essence taking a big broad swipe at prevention, and our best effort at preserving that is community voice. So I know Lupita also said she checked that box, so thank you. But if anybody is interested, please reach out to me. I will send you a template. I'm trying to save people time by having a template ready to go. You just have to cut and paste. If there's something in there you don't like, then delete that sentence or modify it. But please send it to Senators Murray, Cantwell, and Congressman Newhouse. Senator Murray is a vice chair on the Senate Appropriations Committee, so she does have more sway than people would believe because of obviously her being in a leadership role. So anybody who would like that, please let me know. So thank you, Mrs. Melissa. I wanted to make sure that would be stuff because it came roaring out last week.
Anything else? Okay, all right. So we'll move on. We have environmental health, Shawn Magee. Welcome back.
Thank you. You get more of me. So a couple things to address the issue around drug labs here locally with border crossings restrictions and the higher difficulty of seeing drugs imported into the U.S. Law enforcement had contacted us with the concern that drug labs were going to be becoming more of a problem here locally once again, and it didn't take long for us to see that with that RV. So yeah, we refined our process and updated our procedures so that we're able to go out and at contaminated sites, post them for non-entry, and oversee that the site gets cleaned up, or in the case of this RV, it couldn't be cleaned up. It was condemned and removed. So we do have a process in that, and we do have a role to play. And so we look at the lab reports on contamination levels and prior to cleanup and post cleanup to make sure that they meet safe levels for reoccupancy.
Shawn, where was the RV located?
I'm not sure the exact location. I know it was in a mobile home park or court.
Okay.
But I think it was on the north side of Yakima, I want to say. But yeah, I'd have to go double check it.
Okay.
I forgot.
Well, I just noticed when I was going to the chiropractor, there was one parked on the road. Now it's gone, and I'm like, oh, I hope it wasn't near
No,
my
it was in like a mobile home court. So, but yeah, we got that one taken care of. But we do foresee there being more to deal with in the future. So, but we're ready for that. In other news, in the solid waste realm, we received a request for an extension on a permit condition for the DTG landfill. That is the excavation of the full temporary fill area. That extension was denied. They originally asked for 5 months to excavate that area. We gave them 6. They contacted us that they were not going to meet that deadline. The reason this is so critical is that area was approved based on the intact natural liner. You can call it we refer to it as the Vantage Interbed. It's an impermeable layer of rock and soil. They excavated that and down far enough that they're only 70 feet above the aquifer with no natural liner intact. And we already have, nitrates and PFAS issues. And from that original phase 1 cell, which is also under the Model Toxics Control Act with Ecology. And when we issued their new permit back in December, we said that excavation of that material out of that temporary cell was priority number one. So in addition to that, with the enforcement actions taken on another facility and the way we've approached that one, it's important to remain consistent across the board with all our facilities. So at this point, the deadline for DTG is June 12th to excavate that area. As of last week, I believe they were 30% complete. So we anticipate them not meeting that deadline, which would mean they would have to cease the acceptance of new waste and focus all resources on excavating that cell onto the phase 2 line cell. So it is a direct threat to human health and the environment, groundwater in particular. That aquifer feeds several drinking water wells downstream of the landfill. So it's imperative that that gets remediated as soon as possible. Wanted to update the board on that. And we have a meeting coming up with DTG to discuss some more specifics around the excavation of that fill area. Any questions on that?
No, I'm glad that you didn't grant the extension. Good on you.
Those are the major things for my report. For the other one. Oh, yes. And additionally, letters were sent to ownership and management staff of the Cape Limited Purpose Landfill that Ecology is invoking MOTCA, the Model Toxics Control Act, on the Cape landfill for past releases of hazardous materials and the potential release of hazardous material based on waste that has gone in that landfill and past gas emissions and evidence of specifically during the winter time, there's some very unique snow melting patterns at that facility that indicate there is still some excess heat generation coming from that facility, meaning there could be a fire still smoldering under there somewhere. So Ecology is taking action to get that site remediated of any potential hazardous materials that are in that landfill and to address the potential for a fire that may be in there. And it's interesting, some of the gases that were measured there, such as benzene, it's a byproduct of petroleum products, partial combustion of different fuels and oils. It also the potential this also stemmed from there's a commercial vehicle found upside down on top of the landfill, tires still intact, fuel tank still intact. It indicates that there's things in there that should never have been put in there. But Ecology is going to go through that process of figuring that out and getting that cleaned up. So what that means moving forward towards a new permit for them, I don't know. Once those letters or once the negotiations for an agreed order are done, we'll kind of have a timeline on that. Yeah, we expect that we'll hear more by the end of the week or early next week on next steps. And we don't lead that process, but we are invited to participate as subject matter experts in that process. So we'll be involved, but we won't be leading the remediation efforts.
Just comments.
Shawn, question on the vape disposal. Has there been any progress on?
No, not quite, no. To be honest, I've been pulled in a couple other directions, but I know we've reached out to a couple folks, so I'll check with our program manager when I get back to the office, and if that's kind of stalled out, we'll pick it back up.
Okay, great, thank you.
I know that the moderate risk waste facility at Terrace Heights cannot accept it, so it's going to look more like how do we collect these lithium batteries and get them to a place that can be, or to a facility that can break down these vape units and pull the lithium batteries out.
Yeah, well, and then from there, how do we get it on the legislators' radar to make sure that those companies are paying for the disposal? Like,
Yes, absolutely. And I have a platform that I can talk about that on statewide, so.
Just as a point to that, and I appreciate, Alicia, you bringing this up, but similarly, the state already has a law that requires manufacturers and sellers of solar panels in the state of Washington to be responsible for remediation. However, rather unfortunately, the legislature has never required ecology to fully complete forming that requirement, and they continue to grant extensions. And so to this date, if solar panels are installed in the state of Washington, even though technically they are legally required to be remediated out of the state, that is not functionally or practically happening.
Any other comments or questions? Anything else, Mr. Magee?
Nope, that's it.
All right, thank you. We'll move on to the public health partnership with Lilian Bravo.
Thank you. I'll also have a brief update today. As I've been mentioning over the last couple of months, we've been working on a partnership with the National Alliance for Mental Illness in Yakima, Miami. That partnership has primarily been for the community-based workshops to help build with adults skills and talking to youth and ultimately hopefully preventing the use of drugs later on, and just general support and healthy adolescents in general. This last training that we'll be providing in partnership with Gabby will also be in partnership with Comprehensive because we'll be focusing on providers specifically. And that there's two versions of that training. One was virtual on June 3rd, and the next one will be in person on June 6th at Comprehensive. This focus of this particular training was developed because we've been hearing a lot from our first responders and providers specifically with everything going on in our community related to the sheer amount of overdoses happening and sheer amount of mental illness that they're seeing. It's just this provider burnout and a feeling of needing more resources to be able to kind of deal with what they're seeing day to day. And so that's what the focus of these trainings are. Again, that's why we're focusing on the first responders and the providers specifically, is to give them tools on how to manage the situation that they're dealing with, both for themselves and to better help the clients as well. We were able to see that the virtual option just about filled up, and that the in-person option at this time is at capacity as well. So it's been a successful 6 months so far, but we will be formally evaluating the partnership with Yakima. They're very interested in continuing this partnership next year, but we'll be waiting to see, again, that formal evaluation and of course the funding allows before we move forward. And other than that, that's the rest of the programs are going smoothly, and wanted to share that update with you all. Any questions?
Thank you, Lilian. If there's no questions, we'll move on to community health programs, community programs. Gabby, Alvarez.
Hello, good morning, everyone. I have 2 updates for developmental disabilities. We're excited to announce that we have a location and date for this year's transition event. It will be at PNWU, which is where we had it last year. It will be on October 2nd. And last year we had a great success with strong turnout from both vendors and families. So based on the feedback we received from these families, we are extending our event a little bit longer this year to ensure that the families have time to connect and gather information. On the other hand, for DD, we will no longer be under DDA, Developmental Disabilities Administration, according to the new organizational chart that was released by the Division of Social Health Services. Our program will now fall under HCLA, Home and Community Living Administration. So we do anticipate some changes, including shifts with the teams that we regularly work with, and I'll continue to give you updates on that as more comes out. Do you have any questions for that?
Any questions?
As for the front desk, we continue to operate as usual. We are going through construction, so we are committed to maintaining our services through the noise and ensuring that the public continues to receive support. We did add new restrooms outside that are air conditioned so that the public has a safe place to use the restroom. Like Ryan mentioned, the temperatures are going to be going up in the next couple weeks, so this is a safe place for them to use the restroom as well as the individuals that will be testing in there. And that's all the updates I have.
Comments or questions? All right, thank you. We will, there's no unfinished business on the agenda today, so we will move to new business. And the first item is the local health officer update. Mr. Ibach.
Okay, our health officer, Dr. Barg, has informed us that he has sold his house and is moving out of the county. One thing that the board decided a few years ago was the health officer must be a resident of Yakima County. So on the job description, it does say that must be a resident of Yakima County. Board of County Commissioners Ordinance number 1-2021, section 4.04.030, which is on the screen. Health officer appointment. In the event of a vacancy in the health officer position, a new health officer shall be appointed by the Board of Health after the following steps has been completed. It goes through the process as far as advertising for 30 days, having a committee interview, and then a majority vote by the board. So since Dr. Barg will be not a Kent County resident after the end of May, it's up to now. So now it's up to the board how we want to move forward, whether we want to continue the way we are with him as health officer. Dr. Alvarez is the reserve health officer, and why we go through this process, or if we want Dr. Alvarez to become the interim health officer, why we go through this process, or if there's other options.
Sure. Well, remind me first of all that the part that requires that the health officer be from Yakima County isn't in the county code.
Right. Yeah, and it's something, a decision that the Board of Health made that decision, and something that was put on there.
Did you do that back in 2021 or?
I think it's 2021 when we hired Dr. Barg.
I remember why we did it. But in the case of Dr. Barg, I'm personally open to it. Change there.
I am not. I would just say that it's actually, would you like me to articulate why we went through that change in the recent past?
Yes.
Okay. The reason why we did so was because we had, during COVID, we had a health officer who was contracted with many different areas, and it was a custom that occurred. And so we were having a person of great influence over the community and their ability to gather. And we determined that it was imperative that we have a individual who was of the community and residing in the community so that they could best contemplate and understand the impacts and ramifications of their decisions. And certainly I do not, for one, want to be one who so quickly dismisses the destruction of the COVID shutdowns, so much so that we quickly forget why it was so critical that we have someone who is part of our community who can look people in the eye at the grocery store and explain why they made a decision.
The point's well taken, Commissioner McKinney. I guess I'm looking at it thinking, Dr. Barg has lived here for so many years that I don't know, maybe we can Dr. Barg exception. I don't know, but but I'm open to the conversation about it.
I don't want to do it forever. I would just offer my services in the transition time if necessary. And as a consultant for TB and STI matters. So because there's really nobody else in town that has level of experience dealing with those two items. But you know how to do it the rest of my life.
Well, I will comment in that the city of Yakima has made a shift in hiring our new city manager to have somebody who really is deeply involved in the community to be in that type of leadership position. And that city manager has done the same in the hiring of a local police chief who was raised up to the department in his local, and we're just finding a lot of benefits to maintaining that people who know the community in those positions. And as much as I appreciate Dr. Barg, I'm not sure I agree with making the exception here, but I do appreciate, Doctor, that you want to help in the transition. I think that would be critically important.
I would concur.
We made the decision because we really felt that people who are living in and engaged in the community were best suited for the positions we're talking about.
I would concur based on the two hires for the city manager position for Yakima. Of course, Sunnyside experienced it with their chief living away. I just don't think you are as invested if you live afar. Again, not taking away from, we have 100% appreciated. He's been totally vested, but I would be in agreement as appreciating the services in a transition area, but finding a replacement that is a resident of Yakima County.
I think that makes sense. I mean, I'm not arguing one second with the comment earlier about why we put that stipulation in place. I mean, we felt that we had somebody who really wasn't vested in our community making decisions that impacted us greatly. We didn't want to go down that road again. But it also makes sense to have the transition.
Commissioner Lundy, if I could just say too, I think it's critical, especially in positions that we have. We're all stewards of our roles. And when we make exceptions based off individuals rather than consideration of the impact for the role going forward, that's where we find ourselves in patterns that people question in the future. So again, I would like to reiterate my gratitude to Dr. Barg, but as great and wonderful as he is, and he has been fully invested, I think it's critical that we do not make exceptions for individuals and maintain precedent for those future people who follow on our roles as well as his.
Any other comments by members of the board? So I don't think we need to take a formal vote on this at all. I think the discussion indicates to Dr. Barg, we would be delighted to have you help us during the transition period and whatever amount of time that entails until we have a new board of health officer. Yeah.
Madam Mayor.
Yes.
I guess a little bit of confusion on my side. I mean, I thought Dr. Atterbury was the replacement.
So Doc, he's the reserve health officer. And so in his absence, Dr. Barg's absence, he would fill in that role. But if he ever left, it didn't necessarily mean that he was like the vice president becomes the president. That was never established. That was the case.
I think one of the big differences too is when you all were making that decision that the health officer has more of that impact on the policy level changes, whereas the reserve was more just the interim that helped with our standing orders. If we needed to have a TB order placed or STI, it was more like the temporary, acute issues that were going on, whereas the health officer has more overall authority long-term.
Understood. So this board's going to open up the application again and go through another interview process.
Yes.
Okay.
And so then the question is, it's about a 2-month process. Probably the July board meeting is where we'll be doing the vote. So in that 2 months, we have just Dr. Atterbury, the interim health officer, or Dr. Barg remain health officer during that process with the doctor. So that's
Mr. Ibach, I would recommend actually that we need to have corporate counsel representative for the health district to determine the best path forward in this case. It seems to me that there's a question. I, for one, would have interpreted it to mean that our interim would indeed fill in the interim until such a case as we replaced with a permanent health officer. So I do think it's important to discuss this with corporate counsel.
Yes, and I did have a conversation with our attorney, Chris Mertens. He said that looking at this ordinance, it does look like we need to go through the process, and then how we want to move forward in the 2 months is up to the board to make that decision.
Yeah, I'd like to clarify, because what we're talking about is the permanent replacement has to go through the process. The board has the privilege to determine who plays the role of interim health officer until that replacement is addressed. So the discussion is whether, in my interpretation, is whether the board wishes for Dr. Barg to remain in that role in that interim period until we come to a conclusion for a permanent health officer, or if you wish for Dr. Atterbury to take that interim role. Because we do need, for protocol, a health officer oversight. So it's not a role that can't go vacant, essentially.
Let me ask this question. Dr. Atterbury, do you feel like you have the capacity?
Yes, I've been discussing it with various members of the board team, et cetera. And I do feel comfortable in assuming that role while the new person is selected. If the new person is me, in fact, then I'm happy to take that role indefinitely. But whoever is chosen by the board, I'm happy to acknowledge it.
So to Commissioner Cruz's point, one of the reasons that we had the reserve health officers to ensure that we don't have a lack of oversight from a health officer.
Yep.
But that doesn't automatically mean replacement.
Yep.
So you have the choice, and that's essentially the board's choice to make, which is what Ryan was working on with Chris Mertens to ensure that we were in compliance with our own code. Is that right?
Yes.
Okay.
Well, that leaves the floor open for the board to discuss.
Commissioner McKinney here, I just would say that it makes sense to me that Dr. Barg fulfill his role until such time as he leaves and vacates the county permanently, and he notifies us. And at that point, it makes sense, in my opinion, for Dr. Atterbury to fill the role until such a time as we select a permanent.
That sounds like the most congruent with what we laid out with the the reserve officer.
I think that makes sense. Dr. Atterbury has the capacity to do it.
As long as I have Dr. Barg's phone number for any question for on him, I'm happy to. And he certainly shared that with me. Unless he changes his number, I think that'd be the only thing I want to notify you.
Any further discussion? Will this require a formal vote then, or do you nominate?
I think a
so.
motion.
So I would entertain a motion then, and we'll take a vote.
I will move that we name Dr. Atterbury as our acting health officer on the date that Dr. Barg vacates his home in the county while thanking for his service until such a time as the board selects a permanent replacement.
Well, we already had a motion. Would you like to second, Commissioner?
Yes, call it a second. I apologize. I couldn't hear it.
So we have a motion and a second that Dr. Barg would act as interim health director once, I'm sorry, Dr. Atterbury would move as being the interim. I'm on allergy medication here, my brain is and as soon as Dr. Barg notifies us he has left the county. Right? All in favor, please say aye.
Aye. Aye.
Any opposed?
Abstain.
You abstain, we have one abstention, Dr. Atterbury, and all the others are ayes. So the motion passes. Thank you, Dr. Atterbury, and thank you, Dr. Barg.
If I could take a moment, since we're not certain of when Dr. Barg departs, I did want to take the opportunity to thank him for his service. This is really not the normal way we do this, but I do want to recognize, so if his departure is between when we next meet, so that we recognize his service, his commitment to this community, his affection for this community. Having someone of his knowledge and caliber and commitment to his craft in our community has been invaluable for care, but also he readily accepted the responsibility of health officer at a time of great change, embraced it, and we're grateful for that service and appreciate all that he's done for decades.
How many years have you been in the community, Dr. Barg?
25.
25.
26 now.
And how many years is our health officer now?
21.
I'll second that. He stepped in as the health officer at a time when not many people would have been interested. It was a very difficult and challenging time to step in, and he is very well respected. I knew that before he took the position, but there's many times where Dr. Barg will know what's going on at the hospital before I do because they have his number, so they call him directly instead of the emergency line or whatever. So he's very well respected, and I appreciate his service.
I would just add, I've known Neil Barg for well over 10 years, 12 years now. Excellent clinician, physician, a good friend, a colleague, everything you could say about somebody that you've worked with, I would say. And I got a small token of appreciation for Dr. Barg. For any of you who don't know this, this is a Black Plague mask that was worn by physicians during the 1600s, and I wanted to give this to Dr. Barg as a memory of you don't have to put it on. The beak was for putting botanicals and other incense and whatnot. It was thought to prevent spread of plague back in the 1600s. So that's the reason for the beak.
Dr. Humor.
Yes.
Well, thank you, Dr. Barg.
Thank you for your time.
May I just add real quickly, Dr. Barg, that my husband and I were at a dinner recently, and there were several other retired folks in our medical community there, and your name came up. And I just want to let you know that the consensus of the table from these medical professionals is that you were very likely the best doctor and practitioner to ever come to Yakima County from outside of Yakima County. So I just hold you in the highest regard and thank you for your service very much, and certainly do wish you just an abundance of happiness as you move forward in this next journey.
I'm sorry, I'm leaving.
Waited too long.
We're ready to take the vote, sorry. All right. Next is item B is fluoride in municipal drinking water systems that Commissioner McKinney brought this forward. So would you begin, please?
Thank you. I appreciate it. I wanted to bring this forward more for our general awareness and discussion, because I made note there, like many things that we utilize in public health, there are pros and cons and ups and downs. To Dr. Barg, I think he indicated that there are definitely a lot of dentists who would say that fluoride prevents a lot of things, just cavities, and there's been a lot of reasons to say that there are reasons to support why we even have fluoride in toothpaste. But there are also things that have been well studied and are currently is always good, as I say, to double check. And can you hear me now?
Yes, but you're breaking
Is
up.
this better? Okay. I apologize. I'm trying to get back to Yakima. But I just wanted to say that I felt it was important because the EPA has announced that they are looking at new data that shows some reasons to question whether or not fluoride is necessary in our water supply. And I do think that because I personally have been getting a lot of questions about this, it is certainly an aspect of public health, and I think falls under the purview of this board to remain vigilant and aware of these types of issues that the community has concerns about. So I simply wanted to open up the discussion to at least make sure that we are listening to what is happening at the federal level as the EPA endeavors to pursue looking at fluoride additives in our water supply, and especially since they're also looking at as we've all discussed, PFAS. There's a lot of things that have made their way into our water supplies that warrant us looking much closer at how we view the safety of our public water supply, our municipal water supplies. And I will say that there was just a study that came out that showed that PFAS is unfortunately even in our beer, folks. So we really need to take care and pay attention to these things. So that was the reason for my bringing it forward.
I'm not giving up my beer.
Either is Shawn. I just saw him wink.
That's a tell.
Water.
Thank you, Commissioner. Any comments?
Well, I might just throw out a proposal then. You know, I didn't even know fluoride was in municipal drinking water. I thought that was interesting. So there's an educational component that I would be interested in learning more about. So perhaps our next spotlight for next month could be on just what are the regulations regarding municipal drinking water, our water systems in general, and just maybe some science behind it. I think that would do me as a board member a lot of good to at least give me a basis to have a more educated conversation moving forward.
Sure. Well, I do know that Washington State does not regulate the fluoridation of water systems. It's an optional treatment that municipal systems can add. There is inconsistency of the state's Office of Drinking Water website to what I'm actually finding in water quality reports locally. Those suggest that we do have several municipal systems that do fluoridate. And so far there's 4 that don't. And I'm also part of, and I'm not an expert in this at all, very novice, but I'm trying to get up with the speed of the science and the studies that are going on. There's a statewide fluoride science review happening right now that I've been sitting in on, and it's weighing kind of the data that's for it, the data that's against it, and generate kind of a report of that captures both sides of that data. And you know, it's a tool to help communities to decide for themselves if they want to or not. But it's not regulated or required by the state. So it's a local decision.
Do you know who the 4 are that do not?
From what I've been able to gather and I have to verify some of this, so this is, rough data. But Nob Hill water system, Granby water system, Parker Heights, and Moxie do not.
Gotcha.
I believe Sela does not, but they have naturally occurring fluoride in them.
Commissioner Curtis, since this has been brought up by Commissioner McKinney and you asked about that part of, I think what we could do is also a spotlight would be the history of that type of intervention and the reason behind it. It's not just a local or state issue. This is a national thing that's been occurring.
Yeah, well, and I would also take it a step further as far as like legal authority as well for the health district, right? Like, I mean, are we having the conversation and then as a board potentially making a decision that's a recommendation, or do we have any legal ability over our municipals and other, water systems? So like, I don't know that.
So Commissioner Curtis, I would say that I definitely was not going to be bringing this up in favor of adding more regulations and authority by the health district, but this was more for awareness. And the board could have open discussions so that the community members could then go to their local municipal water treatment centers and have conversations. As you know, I am a strong proponent of local control, and I definitely would not like to see the health district or the state have influence over forcing one way or the other.
I would concur, Commissioner McKinney, but I would like possibly the board to make recommendations. We don't have the authority, and I'd like us not to have the authority to make a decision for everybody, but I think we could make reasonable recommendations.
Agree.
I have to correct myself. There's 6 that don't. I missed Granger and Outlook.
And do you know what percentage of our homes in Yakima County are supplied by well water versus municipal water?
That I don't know.
I think you find it to be a higher number than you think.
Yeah.
That's a great point.
There's a lot of well users.
Yeah, I've never lived in the city, and so I've never had fluoridated water.
I think it is an interesting topic. I did a little reading when I found out that it was on the agenda, and it's quite an interesting history, but there is a lot of information that has come out that I think really makes it compelling to have this discussion and bring information to people and really explore the idea of any locality, government, system, water company, just empirically medicating people. And the way it's used is like a medication. And so, yeah, I think it's important to give that back to people to make the decision for themselves. I mean, fluoride could be available in products, through dentists, if people want to do that, but we shouldn't be just making it, putting it in a necessary and essential nutrient for people. And the fluorine itself is not an essential nutrient, and there's a lot of good studies that have shown and some data collection that it does have a lot of detrimental health effects. And so even if there is benefit from it, does that outweigh the risks? And I think it gets back to people needing to have the freedom to make that choice for themselves.
And I like Shawn's idea of presenting both sides. What are the pros, what are the cons? So that we are, especially the most recent ones. And we may not have enough information to make a recommendation after we review that.
We may not, but I think, I don't know if we asked for it next month, that may be a little soon, but I think on the soon coming.
Yeah, I think there's several more weeks of the science review happening. So,
Okay.
And then that report will probably take several months after that review is complete. That's just my estimated timeline, but.
The only other thing I'd like to add is that if we're going to do this, I'd also like to talk about some of the history of dental care in this country, how difficult it is, especially in rural communities, to receive dental care, and the detriments of not receiving dental care easily or well, and the impacts to people's lives, both health-wise and economically, certainly women with brain and so forth. So it's pretty complex, and really the intent is everyone growing up healthy and well.
So I think that'd be helpful as well.
I think a lot of the basis of the review is, fluoridated water systems, and then you add in products that contain fluoride. Is that too much? And it should be like one or the other and not all. But that'll be described more specifically when that report from the science review is available.
Yeah, what naturally occurring fluoride is calcium fluoride, and calcium is good for bones, but what's added to the water systems is not natural fluoride, it's industrial waste, like Mr. Hines pointed out. And a lot of the studies and information that's come out even compares the two. I mean, there can be some issues with the natural fluoride too in really high amounts, but the issues are exponential with the fluoride, the fluoride that's added, which is these other compounds.
Madam Chairman, with your permission, I'd be happy to do a spotlight next month and present both sides of a very simple presentation, little PowerPoint slides for fluoride and its history, as well as its benefits and detriments that are being discussed. I think that the majority of people using fluoridated toothpaste are getting far more fluoride from that than their water supply. So I think everybody should keep in mind perspective. Perspective is always important. There are non-fluoridated toothpaste available, and for those people passionate about the topic, you certainly can buy those and not get any excess fluoride. But I think that if people have a little perspective and then take into consideration our dental health associates, as well as the concerns of community members, where discussions based on health detriments of excess fluoride exposure, I think we can make a rational, at least argument to understand. Every argument is nuanced, and this particular one is quite nuanced. And so the more you know, to Commissioner Curtis's position, I think the better decisions and policies or just knowledge can be made in both from the standpoint of this board and then to the larger, whoever watches this on the internet. I think it'd be useful. So I'm happy to, as my first role in your health officer position, do that for you next month.
I think we'd be happy to hear that. Thank you very much, Dr. Alvarez. Not that we don't expect to hear from Shawn in the future, we do.
He
but I
can,
think
he can
that's
speak
good,
to it better than I can.
a good influx of information right now on the topic that's fresh. If people are asking questions, it'd be good.
But it would be good, Shawn, to have your inventory of
Yes.
like what you found.
Yeah, I'll
And
bring.
I'd also be curious on the cost too, right? Like, what does it cost to put this into the water? Maybe there's some tax savings there.
It's one of those prevention, I will share, it's one of those prevention investments that are really, it's really quite inexpensive. Which is why a lot of municipal water systems have not had an issue with it, because it's really cost effective. But I would ask, if we're gonna have the spotlight next month, if there's still scientific research being conducted, I think it would be premature to make a decision if the information's not there. So if we're beginning with observation, recognition of the history, awareness of the topic, and then we can move forward as a board.
Absolutely.
I'll maybe we disagree with that. I don't think we were looking for any decisions. We were just looking for some information. Sure.
And I certainly don't think, Andre, that the science on any of this is settled. It's certainly a wide open topic. So I think over the next several years, you'll probably get some interesting papers that come out, white papers that might discuss this in greater detail. So, but even then, it won't be settled, but it will be at least further research.
Correct. Right. Any further comment or discussion?
I'd just like to say thank you to the board. This was exactly what I was hoping for, a great discussion.
Thank you, Commissioner. Go ahead, Dr. Barg.
I will get together. There's an article that kind of reviews the whole issues, pros and cons, Scientific American, and I'll get it to Victoria so everybody can get up to speed. It's really an easy way to understand what the issues are.
Thank you. Appreciate that.
And I won't go into any more than I'm going to say because the article will cover it.
Any other comments or questions? If not, that brings us to the end, to adjournment. I would entertain a motion to adjourn.
So moved.
So we have a motion and a second to adjourn. All those in favor, please say aye.
Aye.
Thank you. Any opposed? We are adjourned. Thank you very much.
Thank you.